So I think a lot of things need to happen to change how racism impacts health and to dismantle really the impact of racism on health so that all communities are able to achieve health equity. So I would say racism impacts people throughout the life course. We know that Black and Indigenous infants in particular are twice as likely as their white counterparts to not make it to their first birthday. And that's true here in Minnesota as well as nationally. The impact of racism on health is starting before a baby is born, but once they're born, if they survive that first year of life, there's going to be an onslaught of disadvantage that comes their way across the life course. So we know that 1 in 1,000 Black men and boys have a chance of being killed by a police officer in their lifetime. Here in Minnesota, we are seeing that Black people are more likely to die from COVID-19, and they're also dying at younger ages. So I think COVID-19 is actually the perfect example of how we can ask different and more sort of nuanced questions to get at the heart of what's really going on and therefore figure out how to change it. So early on, the question was, why are Black people so sick and why are Black people so, disproportionately impacted? But we didn't stop to ask the question, what are the potential systems or policies that are rendering Black and brown communities more susceptible to this disease? And I think by shifting the question, we understand then that when we look at the data, Black, Indigenous, and Latino communities are more likely to hold jobs where they are, exposed daily to COVID-19 because they aren't able to work at home. When we talk about an anti-racist approach to research, we're talking about an approach that understands history. An anti-racist research approach also requires that we center at the margins, meaning that the people that are closest to the pain, the people that are grappling most with these issues and are impacted most deeply by these issues are able to lead the work. We have 4 goals that we will focus on in this research center, and those are research, education, authentic community engagement, and also narrative change. And they can't sort of exist disconnected from one another. They are all very much intertwined and sort of support each other, because without authentic community engagement, we can't have real evidence-based research to inform policy and to inform and create change. Again, I think that the education piece is incredibly important as we think about our future in public health and our future workforce and those who are really truly committed to anti-racism and ensuring that it shows up in the ways that they practice public health and are working towards health equity. So the generous gift from Blue Cross and Blue Shield of Minnesota, I think, speaks to the power of collaboration and their bold vision, along with my bold vision of a healthier Minnesota. For me, success, in the biggest sense of the word, would mean that everyone has the same opportunity to be healthy. And success looks like every life being valued in the same way. I fully acknowledge we are a very long ways from that, and that our center will be one part of a larger effort and push that we're seeing, and movement, frankly, that we're seeing across the country to dismantle racism in all of its forms and to achieve equity.